Horses in a therapeutic riding program often have special needs. Recognizing their special needs is critical to maintaining their long term program usefulness. Hi, I'm Dr. Kelly Aaron Clayball, an equine veterinarian,
And I'm April Johnston, an equine physiotherapist,
and we're the co founders of Equilibrium Institute.
where we help horses by educating their people.
The purpose of this seminar is to help you recognize, understand, and manage the unique needs of the therapy horse to enhance their quality of life and usefulness. So, first of all, what types of horses end up in a therapeutic riding program?
Well, they're often older horses, and they're often lame horses, and we even have old and lame horses.
So, one challenge is that the therapy horses are often chosen for their job because of their mental aptitude rather than their physical suitability. And as April pointed out, a lot of these horses are older and lame, or lame. These horses are often retired due to injuries that may have precluded them from performing at their previous level. Fortunately, the injury may not necessarily prohibit them from having a valuable second career as a therapy horse.
And then there's the other group. These are horses that are often donated for a tax write-off, or this broad group we call rescue horses.
This presentation is mostly going to deal with the first two categories, the geriatrics and the horses that are serviceably sound for a therapeutic riding program.
So let's talk about geriatric horses. Many people seek a win-win situation by retiring their older horses to a program where they will be valued and cared for, while the program benefits from getting an experienced, calm horse. However, older horses often have very specific issues that need special management.
One of the most common issues that needs management in the geriatric group of horses is dental disease. Another issue is metabolic disease, as well as degenerative joint disease, organ insufficiency, and recurrent airway obstruction, more commonly known as COPD. Older horses often have vision-related issues.
The serviceably sound horse, while they may not have some of the age-related issues, often has a lot of different types of body issues, such as degenerative joint disease, soft tissue injuries and diseases that can include desmitis, tendinitis, and back pain, a lot of hoof issues, including founder navicular, and then also just hoof issues related to a chronic lack of quality care, and neurological issues.
But let's back up and talk about the issues specific to the geriatric horse. One of the most common issues is dental disease. So by the time a horse is considered aged, usually its teeth are expiring, which means it's running out of surface area to grind its food. So these horses, as they get older, have less surface area in their teeth, or just less teeth in general, and they may have pain associated with chewing, whether from losing their teeth or from having sharp points or hooks in their mouth. They may have pain from TMJ arthritis, where it makes it difficult to have the repetitive motion of chewing. They may have lost musculature in their face as well, which makes it harder to continue a repetitive chewing action. So how would you know if a horse is experiencing dental pain? Well, any of these signs could indicate pain and would warrant a dental exam. Abnormal chewing action with the head tilted or a chomping motion, quitting or dropping feed, where quitting refers to the cigar-shaped wad of grass or hay that falls out of the horse's mouth, weight loss, bridling problems or a head shyness, the horse being unbalanced or one-sided when it's ridden, facial swellings, odorous breath, unilateral foul-smelling nasal discharge, long stem fibers or undigested oats or corn in the manure, or when severe, impaction colic can indicate dental pain. So knowing that older horses can have significant dental wear, what can you do? Well, first, some of the painful issues in the mouth can be corrected. Every horse should have an annual dental exam by a veterinarian, and sources of pain and misalignment should be addressed at that time. Some horses may simply not have enough teeth left to adequately chew long stem fiber. These horses should be fed an extruded complete feed that provides fiber, energy, and a balance of vitamins and minerals. Extruded diets are heat processed, so they break down easily even if the horse cannot chew. Soaked hay pellets or cubes and beet pulp can also be fed. Small, frequent meals are preferable, as some horses simply get tired of chewing and will leave food uneaten even when they are still hungry. Providing 3 to 4 meals per day will allow the horse to consume more calories with less discomfort. Also, be sure that the horse has an opportunity to eat his own food. These two horses are the same age and their teeth are in similar condition. While both horses are fed the same diet, the horse on the right is dominant, is consuming most of both rations. Separating horses during mealtime may be necessary. Watch this horse chewing his food. Notice how much falls out as he chews. Feeding a geriatric horse over a rubber stall mat will allow him to more easily clean up the food that spills out, ensuring he is eating all of the food provided.
Another thing to consider, especially in climates that have colder winters, is to reduce overall energy expenditure. A lot of older horses really start to fall off in the winter and get in quite poor condition. And one solution is to feed them more, but often, given the things we've discussed, this doesn't stop the weight loss. In these cases, it's probably more ideal to try to blanket the horse.
Another issue that occurs in geriatric horses is metabolic disease. And there's some confusion with horse owners as to the difference between Cushing's and the disease equine metabolic syndrome. But in general, geriatric horses usually are going to have Cushing's. Cushing's is actually called PPID, but most people refer to it as Cushing's. And it's a disease affecting the pituitary gland in the brain, and it dysregulates their hormone production in their body, which results in a whole bunch of different symptoms. But some of the most common ones that people recognize is, unfortunately, laminitis, so pain in the feet, as well as a long, shaggy hair coat that doesn't shed out like it should in the spring. So both of these metabolic diseases are more common in obese horses, but equine metabolic syndrome, EMS, can occur in much younger horses as well. It's not necessarily a geriatric disease. But so what you want to do is just try and avoid metabolic disease in general, if possible, by maintaining ideal body weight in horse. Don't let them get too fat, okay? We've already talked about how geriatric horses sometimes like to get too thin, but sometimes they end up being really easy keepers and get too fat, and they're not in as much work, and it just gets even harder to maintain their weight. And this sets them up for some metabolic issues. With Cushing's, though, since it is actually not just nutritional in origin, it's related to a pituitary tumor, you can't just solve it with diet. So ideally, in order to know if the horse has Cushing's, you need to do blood work to identify it, and then treat them with a drug called pergolide to regulate their hormones. Aside from doing that, though, ways to make these horses more comfortable is to shave off all the excess hair that they don't shed out like they should. The biggest one is to keep an eye on these horses for tenderness in their feet. We will discuss laminitis and ways to detect and prevent it in the later section.
Another thing to consider with geriatric horses is arthritis, also known as degenerative joint disease. However, because this issue is not isolated only to geriatric horses, we're going to cover this topic in the serviceably sound horse section.
The geriatric horse, while it's overall aging, so are its organs. So as the horse is aging, the organs may become less able to do their job. The two most commonly affected organs are the kidneys and the liver. With the kidneys, usually you're going to recognize an increased thirst and more frequent urination. If it's severe enough, these horses sometimes will even lose their appetite and act lethargic. Horses with liver insufficiency have less predictable clinical signs. But if you're in general noticing an older horse that isn't gaining weight like it should, despite other methods of increasing its weight, or it's just more lethargic than you think it should be, it's always a good idea to have your veterinarian run some blood work and check for organ function or dysfunction. And pending those findings, your veterinarian would probably make some dietary changes. The owners of this paint gelding were struggling to get him to gain weight despite adequate food and appropriate dental help. Blood work showed that he had liver insufficiency, and changing his diet allowed him to regain his previous good condition. Another condition common in geriatric horses is recurrent airway obstruction, more commonly known as COPD. COPD causes chronic irritation of the lungs, resulting in inflammation and constriction of the airways. This condition is similar to asthma in humans and results in exercise intolerance and increased respiratory rate. When severe, you'll even notice the horse struggling to push air out of its lungs, evidenced by a heave line on the abdomen. The horse might also have flared nostrils as it's trying to breathe. These horses will also have an unproductive dry cough, especially when worked.
This condition is brought on by chronic inflammation brought about by exposure to allergens. Dust, pollens, and molds are the usual culprits. Some horses are more sensitive to allergens found inside the stable, while other horses' symptoms are triggered by outdoor allergens. Indoor allergies can be triggered by dusty shavings, arena footing dust, hay dust, and mold, especially if the ventilation in the barn is not adequate. Methods to reduce dust include using dust-free bedding, watering the indoor arena footing, vacuuming instead of sweeping or blowing the aisleway, not storing hay above the stalls, and watering down the hay or even using hay feeders that can reduce dust. Molds can be more difficult to control, especially in wooden barns and warm, humid climates. In these cases, it is best to increase ventilation in the barn or potentially house the horse outdoors. If a horse is sensitive to outdoor allergens such as pollens, it may be necessary to house the horse inside during the times of year that is most affected. If the management strategies alone do not effectively control the symptoms, medication may be necessary. Anti-inflammatories and/or bronchodilators may be required.
The last issue affecting geriatric horses that we're going to cover is vision impairment. And usually these horses have cloudiness of the lens and rigidity of the lens that prevents their ability to focus and reduces the amount of light reaching the retina. Other issues that can impact the horse's vision include chronic scarring of the cornea, the outer of the eye, or inflammation of the internal structures of the eye. Oftentimes, the first sign that this is occurring is a horse that didn't used to have issues suddenly starts spooking, especially when transitioning from light to dark. While it is often not possible to reverse the changes in an aged horse's eye, it is important to be cognizant of these changes, respecting that the horse may not be able to see as well and therefore may behave less predictably under low light situations.